Hello, and welcome to Gateway Community Health Center's 4th annual Heroes in Healthcare Gala. This year, we're honoring 4 generations of healthcare professionals, the Cigarroa family. A special thank you to all of our sponsors who made this year's gala possible. If you would like to donate, please visit us at gatewaychc.com. Now to start us off, our CEO, Mr. Elmo Lopez Jr.
Hello everyone, I'm Elmo Lopez Jr., CEO of Gateway Community Health Center, and I would like to thank you for joining us for our 4th annual Heroes in Healthcare Gala. This year, we honor the Cigarroa family, whose 4 generations of healthcare professionals have impacted thousands of families across Texas and beyond. We have worked diligently to bring you an entertaining collection of videos about Gateway Community Health Center and a snapshot of the monumental healthcare contributions made by over 20 different members of the Cigarroa family. Additionally, I would like to thank our premier sponsor, Texas Community Bank, who is a proud supporter of Heroes in Healthcare. And I would like to thank the Gala Committee, chaired by Dr. Cecilia Garza, joined by Lulu Rangel Ochoa, Otile Garcia, and David Vasquez. And now on with the show.
For thousands of residents in Webb, Jim Hogg, and Zapata counties, Gateway Community Health Center is a viable link to quality healthcare services that might not otherwise be available to them. What most people don't realize is that these 6 clinics scattered throughout the 3 counties mentioned and the services they provide are open to everyone. It is a true gateway to good health that provides numerous healthcare services to all who come through their doors. Its mission is quite simply to provide quality care for everyone. This nonprofit organization is a lifeline to literally thousands of people who have limited resources and cannot afford traditional health insurance. It allows anyone, regardless of ability to pay, the healthcare services that would otherwise be out of reach. In short, it can extend lives through proper medical care and attention. Low income, median income, or upper income, it doesn't matter. Here, anyone can get quality health care that can fit within any budget. Payment arrangements are geared to the individual and that individual's ability to pay. And more importantly, no one is ever turned away. Among the services offered at Gateway Community Health Center are child and adult primary care, women's health, dental health, specialty care, support services, urgent care, weight management programs, diabetes care, and much, much more. It's important to mention that everyone qualifies for healthcare services and registering is easy. And for anyone needing assistance in obtaining health insurance from the health insurance marketplace, we have certified counselors available to help with applications year-round. There is also assistance available for those applying for Medicaid. Now, when it comes to general healthcare services, adult primary care is high on the list. It includes the diagnosis, treatment, and prevention of acute and chronic diseases and immunizations. We do screenings for diabetes, high blood pressure, cholesterol levels, and other issues. If hospitalization is necessary, Gateway has a hospitalist program whereby inpatient care is provided at a local hospital by a group of local physicians. From admission to discharge, these doctors coordinate care with the patient's primary care provider, or PCP. Pediatric care is another service that falls under this heading. It's provided to newborn infants and children up to the age of 18. Gateway provides both well-child and acute care. Immunizations are also offered for children and adults at all clinics, and medical checkups are also on the list of services for patients in all age groups. Specialty care services include behavioral health, which include counseling and psychotherapy to children and adults. There is even an urgent care clinic open to the public at large, located at the Central Clinic. It's open after hours and is open to anyone who needs care for an acute, non-emergency, or non-chronic issue. And when it comes to women's health, Gateway offers breast and cervical cancer screenings. Diagnostic exams are provided to eligible women who would otherwise not be able to afford such services. In addition, Pap tests and mammograms are provided at no cost to eligible women over 40 and over 50 years of age, respectively. Gateway offers sexually transmitted disease or STD testing as well. Gateway Community Health Center serves as the family medicine outpatient clinic for the University of the Incarnate Word School of Osteopathic Medicine residents. Under supervision, these doctors practice adult medicine, pediatrics, and women's health. It's widely known that healthy teeth and gums are vital to good health, and that is exactly why Gateway Community Health Center includes dental services for patients. Our dental clinics offer services including preventative, restorative, and limited oral surgery services for children and adults. Preventative services include dental exams, x-rays, cleanings, oral hygiene education, and dental sealants. Restorative services include dental fillings and pediatric dental crowns. These clinics offer limited oral surgery that includes routine tooth and molar extractions. In addition, our dental clinic serves as an external teaching site for internships for senior dental students from the UT Health Science Dental School in San Antonio. Support services at Gateway include 2 pharmacies that accept Medicaid, Medicare, and private insurance. We also offer in-house laboratories and imaging services performed under contract with local hospitals. In addition to diabetes management programs, Gateway Community Health Center offers diabetic supplies whereby eligible patients may receive glucometers, strips, lancets, and solutions at a discounted and affordable price. There's even nutritional therapy assistance and a children's weight loss management program that can prevent bad eating habits in children without it developing into full-blown diabetes. Bottom line, Gateway Community Health Center's 6 clinics have numerous services that can accommodate just about anybody who needs quality health care at a reasonable cost. At Gateway, everyone qualifies for services. All you have to do is enroll, and we'll take it from there. We're here to improve the quality of life of every person who walks through our doors. Our core values are service excellence, professional expertise, integrity, dignity, and compassion for all. We are Gateway Community Health Center. In closing, here are a few words from Gateway's Chief Executive Officer, Elmo Lopez Jr.
Here at Gateway Community Health Center, we provide quality health care for everyone. We provide primary medical care, primary dental care, primary behavioral health care, pharmacy and lab services, all under one roof. I invite you and your entire family to visit us at Gateway Community Health Center.
Hello, my name is Douglas MacDonald, and I am the President and CEO of Texas Community Bank. As a premier sponsor of this year's Heroes in Healthcare, it is my great privilege to acknowledge and honor the contributions of one of the most iconic families in Laredo's history, the Figueroa family. Their passion as healthcare providers and professionals have left thousands cured and even more inspired to become part of the tradition of leadership and community. Historically speaking, this exceptional family of medicine has served our community for 4 generations. Many of us have had the pleasure of personally observing as well as experiencing the superior quality and caring treatment of the original Figueroa doctors, Leonidas and Joaquin, and we are now being treated by their children and unbelievably, their grandchildren. The continuity of community service has been passed down through every generation of this family and has been learned at the knees of their fathers. It warms the hearts of all of us to know that with this family's dedication to service, Laredo citizens will most likely be served by Leonidas and Joaquin's great-grandchildren at some time in the future. It is not often that a small border town is blessed with the world-class medical talent. Were it not for the fact that Laredo is the home of the Figueroa family, we would most probably share that same plight. This family's commitment to the health and well-being of the citizens of Laredo is complete and uncompromising. As a financial institution, Texas Community Bank has long supported the mission and values of a prosperous and healthy Laredo. We understand the importance of health and those who maintain it within our city, and fully appreciate the work, effort, grit, and dedication of the Figueroa family of healthcare professionals. Going forward, we all must commit to community service in the same selfless manner that the Figueroa family has demonstrated. They are not only the best at what they do, they share their medical talents with those who need them. the most, anytime, any place. We at Texas Community Bank wish to honor the Cigarroas for their many gifts and accomplishments, but also aspire to reach the same level of selfless community engagement that they have attained. In closing, I would like to thank Gateway Community Health Center for providing high-quality health care in Laredo, and give a special thanks again to the Cigarroa family's 4 generations of healthcare professionals who were truly heroes in healthcare. From all of us at Texas Community Bank, we would like to say thank you.
Hello, my name is Memo Trevino, and I'm a member of the Gateway Community Health Center Board of Directors. It gives me great pleasure on behalf of the dedicated staff and Board of Directors to announce that the Cigarroa family will be our 2022 Heroes in Healthcare honorees. I would like to thank the Cigarroa family for allowing us to honor them and for their 4-generation commitment to making Laredo a better place to live. I would also like to thank all our generous donors who share the same vision of a healthier and prosperous Laredo. I don't think there is a family in Laredo that has not been touched by the Cigarroa family's work as healthcare professionals, or a civic organization that has not benefited from their support or counsel. I've seen them use their rare gifts of combining the science part of medicine with the compassion needed in dealing with people who are suffering at all hours of the day or night. I can say with no hesitation that Laredo is a better place because of their work and dedication. Congratulations to the Cigarroa family, and congratulations to South Texas for being fortunate to have their skills as healers and leaders in our communities. Now we would like to share a video presentation with you about the story of the Cigarroa family, 4 generations of healthcare professionals.
I think being a doctor is the most special gift that God can give you.
Your grandma was Josephine.
No,
Who's that?
that's my great grandmother.
Oh, your
Yeah.
great-grandmother.
Good memory.
Having a call to service and a desire to help others.
Healing somebody is absolutely beautiful.
Being a physician, you're a servant to the people of the community.
I wouldn't trade it for the world.
The Cigarroas, a local family of healthcare providers, have been synonymous with medicine in the Laredo community for decades. For them, healing and building community are guiding principles.
We are a very large, loving family that has its roots deeply intertwined with the community of Laredo.
The history is 4 generations as far as people in medicine.
Their story and history as caregivers began over 100 years ago in Durango, Mexico.
The beginning is my grandfather. He goes back to the 1800s, so now we're talking 3 centuries.
Grandfather Joaquin was born in Mapimí, Durango. My grandmother Josefina was from Durango, and then moved to Mexico City. My grandfather moved to Mexico City to study medicine, and he lived in a boarding house that my grandmother's mother, Rebecca, owned. That's where he met my grandmother. They fell in love. They got married.
Joaquin lobbied for medical student rights and worked toward healing and community advocacy, foundational values that would define his family for the next 100 years. But with the Mexican Revolution raging on and their first child, Leonidas, born, Joaquin and Josefina made a life-altering choice.
My grandfather Joaquin's brother was Leonidas Gonzalez, who founded the newspaper in San Antonio, La Prensa, and his son is Henry B. Gonzalez. And he, convinced my grandfather to come to San Antonio and practice there. And he did. He started his family practice in San Antonio. And then he started this charity clinic in San Antonio. And his practice was divided between his own clinic and the charity clinic.
And his wife, my grandmother, he trained her to be a pharmacist. This is Depression times when he came.
People started leaving and going more to the charity clinic.
After moving, Joaquin and Josefina had 2 more children, Joaquin and Rebecca.
And then one of the doctors in Laredo, one of the family practice docs in Laredo, was retiring, and he offered my grandfather a position in his practice in Laredo. So my grandfather felt like Laredo was on the border. It was an area of need. He loved the idea of being on the border.
And he ended up coming to Laredo and starting a practice here in his home. And that's where, his practice was almost till the day he died. And he really enjoyed what he did. And I think that set the tone for the next generations, because his generation was not a generation of physicians. My grandfather came from engineers. His brother, Leonidas Gonzalez, all of his descendants all went into the politics and lawyer field. So medicine was a complete and different outlook for the family.
He started his clinic there. He educated his kids. He was a big, believer in education. And his kids kind of shadowed him from when he was in family practice.
Described as unconventional and out of the box, Joaquin's top priority was his patient's health.
A man is stabbed in a bar with an ice pick. He's the first person in Texas who cracked his chest and actually pulled the ice pick out, sewed on the heart. It had never been done in Texas. And he was the first one that made the San Antonio Express.
Inspired by their parents, Leonidas, Joaquin, and Rebecca followed in their footsteps and pursued careers in the medical field. Leonidas attended Loyola and became a surgeon. Joaquin attended Harvard and became a physician. And Rebecca graduated from the University of Texas and became one of the first female pharmacists in South Texas. All three children returned to Laredo with their spouses and worked at their family clinic.
My mom she was rotating on search. She's from Chicago. Total Anglo-British background. On their honeymoon, she spent it with the book learning how to speak Spanish to come to Laredo.
Medicine defined them, and nothing came in the way of them and their patients.
They'd knock on the door, and my grandmother would answer in her pajamas, and it would be a patient.
And we saw how much they loved medicine and how much the community was grateful to them.
All of our previous generations were our heroes. Kind of grew up watching them, take care of people. My mother had this photographic memory. She knew every patient, and so did my grandmother. And she also knew their stories. So it was interesting. They would come down and she would ask, how's little Lucy? How's, Lucia doing or whatever. She knew. It was really interesting to watch how she dealt with people. And also, how kind and caring she was with them. It just kind of modeled for us that we kind of wanted to be like that. We had these family comidas where, my Uncle Leo, my Aunt Peggy, and my mom would go every Sunday.
And my grandmother would give us each $1, and it's a savings for your college. So from age 4, we knew we were going to college.
We actually watched my Uncle Leo's surgical videos, and we listened to them talk about medicine.
Two pillars in our family that we really hold on to are both education and service. My grandfather was able to bring those two and intertwine them so beautifully in the way that he practiced his medicine.
I just remember him telling me, you're not done when you're done when the last patient leaves. And so I always saw him live that call to service.
We witnessed satisfaction in our parents.
Leonidas, Joaquin, and Rebecca's unwavering dedication to healthcare and their community inspired many of their children to continue their path.
Anytime I'd express an interest in a particular profession or field of study, he'd always say, yeah, that's fine. As soon as you got your medical degree, you can do whatever you want to do.
It was in our culture. Really, the bottom line, it was a culture we grew up in. People grow up in families of law enforcement, people grow up in families of teachers. We grew up in the culture of medicine.
Of those 3 children, we had 24 in my generation, and quite a few of us went into medicine also.
Of the 24 from Generation 3, 14 went on to become healthcare providers. The next generation added 19 Cigarroa family members who study or currently practice medicine.
Not everybody went into medicine. A big proportion of our family did. But, pretty much everybody in our family has gone to some profession that involves service. It's just we were taught to care.
That's kind of the common denominator as to why our family has chosen healthcare, because we love the people.
Decades later, the Cigarroas continue to employ lessons taught by their elders.
prior to Medicare. It was not unusual that the patients would pay with borregos and fruits and vegetables from the yard.
Or eggs from somebody's, ranch. It was more about how to care for people and not really feel like they needed to be reimbursed in a certain way. That was a really big model for us that I still practice in my own practice. When I have a patient that can't afford a particular care, I try to find a way to take care of them. I remember being with my Uncle Joaquin when I was in high school and college and making rounds with him. He taught me that when you walk into a patient's room, you always sit down. He had 40 patients that he would round on every morning. And he said, no matter how much of a hurry you're in, you sit down. You sit down, you listen, you give undivided attention to them.
Go to the bedside to have a conversation with patients and really, really create that relationship.
Way beyond the accolades and the awards. I think more about taking care of individuals. It's taking care of Mrs. Garcia and Mr. Johnson.
2 generations of experience and a core set of values prepared the family for one of their harshest challenges, the COVID epidemic.
My oldest son, Marco, his first year of internship ended up in New York City during the COVID epidemic. And he happened to be at Jacobi Hospital, which was the epicenter of COVID. He learned a lot. It was hard on his heart. He had a lot of loss. He snuck in 2 daughters of a lady that was passing away, not from COVID, but because she couldn't see her family before she died. And he checked them, did all the proper testing to make sure there were no signs of COVID. But, he brought them in and sure they were able to say goodbye to their mother, and he got in trouble for it. But he still to this day says it was the right thing.
It was tragic for our community. We lost 1,000 of our community members. And it was my strong belief that the more the community knew about exactly what the truth was, the more they could protect themselves.
Ricardo took to social media and local news outlets to share unfiltered updates and advice on how to navigate the epidemic. Many Laredoans found comfort in his honest, consistent, and reassuring presence.
Cardiologist, Dr. Cigarroa, thanks for joining us here.
We ignored everything except the truth. And I think the community appreciated that. If you believe something's right and it's a truth, even if you're defeated, you keep battling because it's the right thing.
Over the course of 5 generations of Cigarroas, the milestones and accomplishments are plenty. They include lobbying for government funding for Laredo Junior College, the establishment of the first NICU in Laredo, and the creation of the Cigarroa Surgical Center. Though much good has been done, the family's crowning achievement remains the relationship they hold so dearly with the community.
I really do believe that our family has been, advocates of trying to get the best kind of medical care, certainly in South Texas.
Medicine gives you this special opportunity, especially in communities like Laredo that are so medically underserved.
Being able to come back and sort of bring medical expertise to the area has been a really big deal.
The Cigarroas are really a family that has been blessed abundantly.
The community really truly cares about you, not just as their medical provider, but cares for you as a person.
I think it's been a beautiful relationship between the family and the community over many decades. I was at a local restaurant at Buffalo Wings, and I was sitting there by myself watching a football game, and I got up to go to the bathroom. And when I came back to the table, on just a little napkin, someone wrote, "Thank you very much for caring for Laredo during COVID." And I asked the waiter, I said, "You know who put this here?" And he goes, "No, but I saw a 15, 16-year-old boy come over here, write something and leave it." And then he left. And so for a teenager to do that, it really was something very beautiful. And I knew that we made a difference. 50 years from now, I would love to see that same beautiful relationship between community and the family. I would love to see service and being engaged with policy. But most importantly, to be available to the ill. Anybody who's sick, no matter what. Whether they have funds or they don't have funds. Every person deserves to be cared for. I want to thank the community of Laredo for taking such beautiful care of my family and for allowing us to grow old with them.
On behalf of the Cigarroa family, I would like to thank Gateway for honoring the profession of medicine and the care that our family, through generations, has rendered to South Texas. Gateway, the Sisters of Mercy, the Laredo Medical Center have all been integral to our family's success. We thank our beautiful community for being so loving of our family, and together we look forward to another 100 years of caring for Laredo. Through public service, supporting public education, and providing the best healthcare possible. Con mucho cariño from our family to yours.
Thank you so much for joining us for Gateway's 4th annual Heroes in Healthcare Gala. A special thanks to all of our donors who made this year's event possible. If you would like to donate, please visit us at gatewaychc.com. We invite you to become a patient at Gateway Community Health Center, where you would experience the highest quality of medical, dental, and behavioral health care. To become a patient, please visit us at gatewaychc.com. We look forward to serving you, and we look forward to seeing you at our 5th annual Heroes in Healthcare Gala.